Well, welcome everyone. My name's Kerry Dove. I'm the chairman of the HR committee for the Tennessee Chamber of Commerce and Industry, and we appreciate you guys all calling in for the discussion that we're going to have today in response to questions we're receiving on the coronavirus impact on industry in our communities. We have a couple of guest listeners. I want to welcome to the call Representative Clark Boyd, who is the chairman of House Consumer and Human Resources Committee, and anticipating Senator Paul Bailey, who is the chairman of the Senate Commerce and Labor Committee. So welcome, gentlemen, if you're on the line. Our call today will be moderated by two gentlemen, Fred Bissinger. He's a regional managing member of Wimber, Davis and Jones, and Ed Trent, who's a member of the same law firm. We appreciate you guys lending us your time today to talk about this important topic. A little housekeeping. We have about 6 or 7 bullet talk points that I think you received in the communication about this call. We're going to turn Fred and Ed loose on those, and given that we don't have a lot of time, we are accepting questions online at the website that we provided for you. So if you have any questions, just send them in to that email address. Lauren is going to take those questions, and we're going to get the answers of those to you. We're going to put that all together and distribute it to everyone like we did this invitation. So we don't really have a lot of extra time to take questions. Maybe at the end of the meeting, if we have time left over, we can take some questions. But for right now, I'm going to turn it over to Fred and Ed. Gentlemen?
All right. Thank you, Kerry. This is Fred Bissinger, and I manage our firm's Nashville office, and my partner, Ed, is in our Knoxville office. And we've done a decent bit of speaking already in the last couple of weeks on this pandemic. And so I can tell you, I don't think we're going to have time left over for questions and answers at this today, but we'll certainly try to follow up in writing as best we can. So let me give you some background thoughts. And for those of you who are HR managers or otherwise you are trying to manage this scenario, there are some big picture issues I want you to be thinking about. First and foremost is that we are simply in uncharted territory in many respects. There are not going to be clear answers to a lot of the issues that are out there. You know, Congress is trying to catch up. We have this $2.2 trillion stimulus package that apparently is passed in the Senate. It's supposedly going to be approved in the House and then signed by the President maybe Friday or Saturday. It apparently has some significant provisions regarding supplemental payments to people who are laid off and collecting unemployment. Again, all of that is to be determined, and it may be that we need to get back on the phone a week from now and revisit where we are then. But my point is, first of all, when you're making decisions in these uncharted territories, you're going to have to do the best you can to use common sense and good judgment. Because there are not always going to be answers that are immediately available to you. It may turn out that you make a decision and you realize, a week after the fact that there's subsequent guidance from, for example, the Department of Labor Wage and Hour Division that says you should have done something different. Well, then you're going to want to timely address those issues to fix them as best you can. So again, common sense and good judgment are really, really important factors when you're in an environment like this. Likewise, you want to keep a written trail of why you're making decisions that you're making so that if you get into fights at a later point in time with why people were laid off or why certain people were laid off and other people weren't laid off, is that you need to defend yourself if you end up with discrimination charges, et cetera. I also wanted to mention that there are a number of legal issues that we're going to address today. But one of the more important issues that is a non-legal issue that factors into everything you're going to do is your leadership. Your employees are freaked out. I'm an owner in a business. I've managed an office for 17 years. I can tell you, people are freaked out, right? And so the question is, are you going to be leading in a calm, deliberate, thoughtful manner and communicating with people in a way that allows them to understand what it is you're doing, why you're doing it, and that they have an open channel of communication with you so that if they have questions or concerns, that those questions or concerns can be addressed and responded to in an appropriate manner. But you being calm is important. You being thoughtful and deliberate is very, very important. Decisions that are made in a hurry almost never work out. It is better to take, an additional 24 hours if you can. Do your homework, think it through, think about how you want to communicate it, and then convey your decision. And any decisions that you make, you need to approach with a 360-degree analysis. And this is very important because we're going to talk a lot about the FFCRA and how it interplays with FMLA as well as the FLSA. But that's only part of the picture. There are a whole host of other laws that come into play. For example, OSHA, ADA, work comp. So you want to make sure you have a checklist of all the potential legal issues that you might encounter so that you can, every time you're making an employee-related decision, you can work through your analysis from start to finish, covering all of the potential issues. And you do that for each and every employee. That way, you're using the same process for every employee who might be potentially affected by a decision that you make. That will enable you to avoid a lot of pitfalls as opposed to if you're just looking at the primary issues and not looking at all of the issues. So that 360-degree analysis is very important. Last introductory point I'd like to make is you really need to stay up to speed as best you can. We have a free electronic newsletter that you can sign up for if you send us your email address. All of the big law firms in Nashville have free electronic newsletters. You should sign up for all of them. The Department of Labor Wage and Hour Division has a free electronic newsletter. You should sign up for it. The EEOC at eeoc.gov has a free electronic newsletter. You should sign up for it. You should get as many sources of information as you can to help you stay up to speed and be as well informed as possible. One other thing I wanted to mention, though, I talked a little bit about your leadership and your soft skills in terms of being thoughtful, deliberate, communicating in an appropriate manner. It's important for you to set that example, but keep in mind that your frontline supervisors and managers who deal with the employees that they are responsible for on a daily basis, you need to make sure they're up to speed and they're not saying and doing things on your behalf that don't add up. And if they don't know answers, they shouldn't be, talking to people about what might happen or what they think is going to happen, because that only breeds confusion and potentially distrust if they say something that is incorrect, and then at a later point in time you have to come out and correct them and tell the employees that the manager was wrong. You want to make sure your management team is on board with, one, understanding what they are and are not authorized to talk about. Two, if they're authorized to talk about issues relevant to this whole coronavirus scenario, that they are on the same script with what you as HR and the senior management team have agreed upon as the message. So one or two other quick points. One issue that has come across our desk and quite frequently last couple of weeks is, employers calling us and saying, hey, we want to furlough people. And is furlough the same as layoff? Well, technically speaking, they're probably the same. I will tell you that furlough is a much kinder, gentler term than layoff, and it may have a positive psychological effect to use that word instead of layoff. It also does imply that it is more of a short-term period in which the employee will not be working, as opposed to layoff, which many times has the connotation that it's permanent. But I want you to understand that you can use the word furlough because it's an appropriate term if you are generally intending to bring people back to work. But when you lay them off, or when you put them on a furlough, and you fill out the Tennessee separation notice, that form does not contain the term furlough. It will have you check the box lack of work, and under that it will say, is the layoff permanent or temporary? And if it's temporary, when are they coming back to work? And so if it's a temporary layoff, it's a quote furlough, end quote, you're going to check lack of work, temporary, when they return to work, to be determined. Okay? But your employee may say to you, hey, Mr. HR manager, you just said that we were furloughed. yet you gave us a separation notice that says we're laid off. What's the deal? Many be aware of the distinction or the lack of distinction in that language, so you need to be prepared to answer questions appropriately. Likewise, when they go on to the Tennessee Department of Labor website to apply for unemployment benefits, to see the term layoff, layoff, and layoff. So you want them to be prepared to understand that, generally speaking, that layoff and furlough are very similar, but they're going to see in the formal documentation the term layoff. A related point is that any decisions that you make in this process, especially if you're going to reduce hours, reduce pay, or lay people off, you need to make sure you're doing it in a manner that is consistent for similarly situated groups of people, such that you don't inadvertently run into claims of discrimination based on race, sex, age, religion, national origin, disability, et cetera, et cetera. Okay? And likewise, you don't want to make any decisions in a manner that could be deemed to be illegal retaliation. For example, if you have an employee who says to you now, hey, when that new law becomes effective next week on April 1st, I need to stay at home because I have to take care of my kids and because they can't go to school, et cetera. And then your response is the next day, okay, you know what, Bob, you're laid off. Bob is automatically going to think he was laid off because he told you that he wanted to utilize the leave benefits provided for under the FFA become applicable. You need to be very thoughtful that you don't make mistakes like that lead to claims of retaliation. All right, that's my quick introduction. That was a little longer than anticipated, but Ed and I are going to segue into the FFCRA and FMLA. So Ed, give us the high level on the FFCRA, FMLA Expansion Act, and then I
guess kind of to start with, as we go in, we're going to start with the Families First Coronavirus Response Act, which we're referring to as the FFCRA. So you're going to feel like you're swimming in a bowl of soup or you're in the middle of acronym nightmares, but all of these various laws will apply together. But the FFCRA was signed last week on March 18th by the President, and it provides for a couple of things. The first thing it does is it provides for an element of paid sick leave, which has not been mandated before under federal law, but here it's going to provide 2 weeks of paid sick leave for certain criteria, which we'll do in a moment. The other aspect is that it's going to expand the Family Leave Act, the FMLA, not only to cover the reasons of being out of work due to child care issues, where an employee has to be at home and is unable to telework because their children's school is closed or their child care facility is closed. That has not been an element of the Family Medical Leave Act prior to the statute last week. And the third part of that is that the benefits that are paid out under this new statute, the FFCRA, do provide for a tax credit against your payroll taxes for the quarter in which the wages are paid. It's a dollar-for-dollar tax credit. It goes against the payroll tax obligation, and if you pay more in wages than what the credit would be, any excess is considered an overpayment and will be reimbursed. We're not going to get into tax elements. Know that it's there. Your tax preparer and your tax folks should be able to get you up to speed on that when the next quarterly benefit comes out. The statute is effective April 1st, so next Wednesday on April Fool's Day, which is always a great time to start something new. The first provision on paid leave is there are 6 areas all related to the COVID-19 outbreak, 3 of it which are directly related to your employees and 3 of which we relate where they need absences to take care of somebody else. So if you've got an employee who has to be out of work and is unable to telework due to a state, federal, or local quarantine or isolation order that's related to the COVID-19, or if they've been advised by a healthcare provider to self-quarantine because of a COVID-19 exposure, or they are experiencing COVID-19 symptoms, fever, cough, things are, I think now loss of taste and smell may be included in those, and they're seeking a medical diagnosis, any of those would qualify them for emergency paid leave. And what your employees would receive is they would receive up to 80 hours of emergency paid leave if they are full-time employees, or their average equivalent of how many hours they work in 2 weeks if they're part-time, at their regular rate of pay with a maximum amount of $511 a day. So if the employee makes less than about $136,000 a year, they're going to get their regular rate of pay for up to 80 hours of paid sick leave for one of those criteria that I just mentioned. If they have to be out of work to care for somebody else who is subject either to that state, local, or federal order on isolation, to care for someone who has been advised by a healthcare provider to self-quarantine because of exposure to COVID-19, or is experiencing COVID-19 symptoms and is seeking a medical diagnosis, could be a child, could be a spouse, another family member, things of that nature, then they would receive paid emergency leave for that purpose. If they're also out of school to care for a child because either their school or place of child care is closed due to the COVID-19 reasons, then they also qualify for emergency paid leave. Or if they experience any other similarly situated condition identified by the Department of Health and Human Services, of which we're not aware of any at the current moment. These last three reasons, they also get either the 80 hours if they're full-time or an equivalent number of hours for part-time for 2 weeks, but only at 2/3 their regular rate of pay. So there's not a big incentive to try and take it off, but if they do get that paid leave incentive. For those of you looking to make this maybe a little bit more complicated from some of your folks, the regular rate of pay, which I'm sure Fred will ask me to explain later, is under the Fair Labor Standards Act definition, which brings in the FLSA to how some of this works. The law applies only, though, to employers who have less than 500 employees. If you have more than 500 employees, everything we're talking about with the FFCRA does not apply. And if there are questions as to what thing we can do as a follow-up question to answer for you. Also, for under 500 employees, there has been an expansion to the Family Medical Leave Act. It is only for the situation where an employee must be out to care for her child whose school or child care facility has closed due to the COVID-19 outbreak. So we've got the governor's recommended schools in Tennessee, public schools closed through April 24th. So you very well may have some employees who say, look, my kids are going to be at home, out of school. I've got to be there to take care of them. If they are able to telework, you can allow them, and you allow them to work from home, then they would not be eligible for leave because they're going to be working and you're going to pay them for working. And we'll talk about where they may work part-time versus full-time in another question here in a little bit. But that is the only change in terms of reasons for FMLA. The other modifications, though, are all employers with one employee up to 500 are covered by this new provision. So if you work for a company that has less than 50 employees and the FMLA has never been on your radar, it is now, and only for this particular reason. It will operate and cover all employees who have been employed for at least 30 days at the time they request leave for this reason. So if they were hired on or before March 2nd, they will be covered as of April 1st. If they are hired sometime in March, 30 days after their hire date, they would be eligible to take this emergency FMLA leave. The emergency paid leave applies to all employees regardless of how long they've been employed. So under the emergency FMLA, what would happen is the first 10 days that they are out, it is considered, quote, unpaid under the FMLA. But they can use their emergency paid leave to pay themselves or to have you as the employer pay them for those first 10 days. They also have the option of using any other employer paid leave entitlement such as PTO, sick leave, any other kind of paid leave that they would qualify for to cover those first 10 days. Thereafter, up to the full 12 weeks of FMLA protected leave, they get a paid 2/3 of their regular rate for their absences. It's the same 2/3 that they would get under the emergency paid leave to be out to care for a child. Now, if you are an employer with 50 or more employees, these provisions apply exactly to you. But it may be that you've got employees who've used FMLA here more recently, and so they don't have a full 12 weeks left. Whatever balance is left, they could use also for this emergency FMLA. It's not a new week. It's part of the overall 12 weeks they get in a 12-month period. There are anti-retaliation provisions, so you obviously can't choose to terminate someone who used these provisions, but they are provided to folks to be able to be used. There are questions with regard to accepting the need for doctor's notes, and given the concerns with the overwhelming of the medical field, certainly encourage you to maybe find an alternative or be a little bit more lax on what kind of notes you require from your employees. The last part of this, before I'll let two parts of this before Fred you can start asking some questions on it, is the Department of Labor has issued the required posting that all employers must put up where all of your other employment-related posters are in your workplace. Also can go out online or by email to your employees. You can download it from the Department of Labor website, print it out, put it up. You don't have to pay anything for it, but it must be posted. And it provides a general summary of what I've just talked about. The other part is that there is an exception within the statute, two kinds of exceptions. One is for healthcare providers and emergency responders. For an employee who, as that term is defined in the Family Medical Leave Act, of the healthcare providers can exempt those employees from the provisions of the FFCRA. So that if they're doctors or nurses who are licensed to provide medical care in the state, the employer can opt out with respect to only those employees. Front office personnel, receptionists, file clerks, things of that nature who are not healthcare providers would still be entitled to all the benefits under the FFCRA. There's also a provision that allows the Department of Labor to exempt certain small, and the Department of Labor may exempt them. The criteria for that exemption has not been issued. Department of Labor says that will be out sometime in April, and they said they will obviously keep people informed. So that's why it's important to check the Department of Labor website. They've got a COVID-19 page that is easy to get to and provides a lot of links and resources on any of the updates. So if that may be of a concern for you, to continue to watch that, but I would not expect those regulations to come out for at least another couple of weeks. That's kind of the general, Fred, of how the FFCRA works with medical leave or sick leave and the expanded Family Medical Leave Act.
Okay, so let me ask you this scenario. If an employee after April, and my questions are assuming this is after April 1 when the act is effective, if an employee is not able to work because he doesn't send his kids to school and doesn't have daycare, what payments is he entitled to under these laws?
He's immediately entitled to 2 weeks of emergency paid sick leave at 2/3 his regular, the number of hours he would normally work over 2 weeks, to a maximum of 80 hours. Those 2 weeks would also count as protected leave under the Emergency Family Medical Leave Act. And then anything after that first 10 days would also be paid at 2/3 his regular rate, up to a maximum of 12 weeks of FMLA.
All right, and if you don't mind, clarify the first 2 weeks, because when you look at the employee rights poster that the Department of Labor has just issued, it says the 100% reasons, it's numbers 1 through 3, which all pertain to the employee himself or herself being sick, because that may be a little confusing to people.
Yes, so this reason is number 5 on the poster. It's also number 5 in the statute that allows the person to get paid leave for an absence related to a child who's unable to go to school because the school is closed or child care is closed because of the COVID-19. Their payments are 2/3 their regular rate up to a cap of $200 per day. So under the FMLA, which is 12 weeks, the first 10 days are presumably paid either through the emergency paid leave entitlement under the statute or by using some other employer paid leave benefit, maybe PTO, maybe their vacation, maybe if they're sick leave bank for that reason in accordance with company policy. But at statute, they get, again, 2/3 of their regular rate up to a cap of $200 a day, which would be making anyone making $75,000 or below would be their regular rate. Above that, it's $200 a day for the balance of their FMLA time period, which would be a maximum of 10 additional weeks.
Okay. And what if an employer lays people off before April 1, will those employees that have been laid off be eligible for these benefits post April 1?
They're not. These benefits do not no one becomes entitled to the benefits until April the 1st. Anyone terminated prior to April 1st is not entitled to the benefits. And anyone who gets terminated after April 1st, their entitlement to the benefits ends on the date of termination.
So if an employee says to an employer, hey, you laid me off, you furloughed me, and you indicated on the separation notice that this is a temporary layoff, so that means you've not really terminated me. I should be entitled to benefits once they kick in on April 1. What's the answer to that?
The employee would be incorrect because they have been separated. We anticipate being able to bring them back, but they're no longer an employee from the moment they've been laid off. So they're not entitled to any other employment benefits from that day until they're rehired or brought back.
If an employer is able to kind of keep on trucking for the next week or two, and let's say in the middle of April they decide, you know what, this isn't working, we need to lay people off, and they lay employees off, if an employee at that point working and has not already started utilizing these benefits contemplated under the new laws, once you lay them off, are they then entitled to utilize those benefits?
They are not, because their right to the benefits ends on the day of their layoff. So they can't come back, well, look, in 3 weeks after you laid me off, I would want to use these benefits. They're not an employee. They're not entitled to them.
And tell us, well, let me ask you this scenario. If the employee post-April 1 puts you on notice that they need to utilize the benefits and they have to stay home, not because they're sick, but because they need to care for a child, let's just say that they do that from April 1st to April 15. On an April 15, the employer decides, you know what, given the state of this economic downturn, we need to lay off, departments X, Y, and Z, and the employee who's on the leave is in departments X, Y, or Z, and then they are subsequently laid off as of April 15. How does that play out?
It plays out as if, one, the employee is, obviously they lose their right to benefits upon the layoff. And it becomes very important, regardless of when the decision is made, is that any layoff decision are made without regard to any sort of protected status. And use of this leave would be that. It's like you would make a layoff decision on the basis of race, sex, disability, age, things of that nature. So if we're closing all of these departments and everybody in that department gets laid off, it would be very difficult for anyone to be able to credibly claim that the reason they were selected for layoff is because they used their 2 weeks of emergency paid leave, or they were on the emergency FMLA leave. Because even under the FMLA, if their position is eliminated, then that's when their benefits would end at that point. So the same would occur here.
So when the employee comes back to the HR manager and says, hey, you can't cut off my benefits, is the employer's answer, well, we can because you're no longer employed as of the date of separation, and we're going to transition you to unemployment?
Yes, and it's pursuant to the statute that is very clear that says the company owes no additional compensation to an employee following their separation, regardless of the reason of separation. And you're always going to have some employee who's in the middle of using some kind of benefit that goes away upon termination. This would simply be another one of those benefits.
Okay. Tell us about the calculation of the regular rate, because I think that's a trap for the unwary.
It is, and it's, for most it may be fairly easy to see, but it really is going to impact folks on their regular rate when you look at things other than maybe their stock wages. So employees who receive tips, who receive commissions, who receive non-discretionary bonuses, all of those sorts of things factor into their regular rate under the Fair Labor Standards Act. You follow the exact same analysis here in determining what their regular rate is. And if it varies, say, from week to week or quarter to quarter, you're going to look at what their average effective regular rate was over that time period, and that's the rate you would use to calculate their paid benefits. You would take that rate and multiply it by the number of hours that they used of the emergency paid leave or for the emergency FMLA to calculate how much you owe.
Okay, Ed, let me ask you to transition a little bit. If a company lays people off or they furlough people and they have a policy that, or a practice to allow or require employees to use all paid time, accrued paid time off. How does that play out in this current scenario?
If I understand right, well, two things. One is companies typically will require someone to use any accrued time off before they go on to unpaid leave. Here, you cannot require that before using the emergency paid leave benefits provided under the statute. They're allowed to use those first. If someone is laid off or terminated for whatever reason, then you follow your company policy on that employee's entitlement to receive the paid leave that is provided by the employer. So if they've got 30 hours of PTO in their bank that have been unused and your policy provides that that is normally paid out upon termination, when they are laid off, you would pay them. Now, if companies want to go back and review their paid leave policies and how they can be used and whether they pay out on termination, they can do that. Companies may also make a decision that says, look, we anticipate this to be a short-term furlough, and we anticipate bringing you back hopefully within 3 to 4 months. We're going to hold your PTO bank. If we rehire you in that time, it's there for you. If we don't, then we will pay it out at the end of that time period. But I would make sure that there's a policy clarification on that now so that there isn't a claim by somebody that says, hey, that was wages due to me upon termination that you didn't pay. So I would make sure that the policies are clear on what you want.
If it's an employer's policy or practice to pay out the accrued benefits at the time of separation, and you're doing a group layoff, and the company says, you know what, if we have to pay out the accrued PTO for these 25 or 30 people that we have, we're a small business, that's going to crush our cash flow. How do you handle that one?
One of the things then to consider is whether or not then to put everybody down to 0 hours. That has been one thing that some folks have talked about. They've not been separated. They would be entitled to receive unemployment compensation because of the cut in hours. But then their PTO, they could use it over time rather than a single lump payment. Would be one way of looking at it. Otherwise, you need to modify your policy now that says, look, here's what we're doing in these times, and we'll reconsider whether or not there'll be a policy change after we get through this, this crisis. But I would make it a policy change available for current employees.
All right, one more question on this topic, and I want to transition to FLSA, and that is, you know, that everything I've read talks about that an employer should try to get some sort of fitness for duty exam if an employee is going to return to work, or on the front end, that they try to get some sort of a doctor's note indicating that they've been diagnosed with COVID-19, if that is in fact why they need the leave. How do you address those two issues?
I think one, particularly if a doctor's note, they're unable to get it, and I think most doctors' offices these days are probably not having employees to come back in unless they're going to be retested. So I would follow the CDC guidelines. The one is if the employee is not going to be tested for COVID-19, then what they need to have is first they need to be fever-free for at least 72 hours without the use of fever-reducing drugs, so no Tylenol, things of that nature. Their other symptoms have to have been improved, and they have to be at least 7 days past when the symptoms first appeared. So it'll be a minimum of 7 days out, and then at least 3 days since the fever went away. If they've been tested for COVID-19, then they have to be fever-free for at least 24 hours. Again, symptoms improved, and they need 2 negative tests in a row. They're at least 24 hours apart. Under the latter part, if you're being tested, the doctor will be able to provide that, hey, we've got 2 negative tests within 24 hours, they can bring that in. Otherwise, you have to have the employee note that they have followed the previous guidelines. And if you find that they look like they're still experiencing symptoms, you send them home.
Okay. Are there any other points on the Expanded Leave Act, the Sick Paid Leave Act, or Expanded FMLA Act, or FMLA in general that you want to contemplate before we move on?
I think those are some of the main big issues, and just folks need to be aware of them as they start to anticipate how they may impact their own individual work environments.
Okay, let's transition to FLSA. One of the questions we've been receiving quite frequently is, for my non-exempt hourly employees, I want to keep them working, but I can't afford to pay them at their normal pay rate. Can I cut their pay? What's the answer?
The answer is yes, provided you don't go below the applicable minimum wage in the area where you are. So you can't go below federal minimum wage, which is $7.25 an hour, but for the hours that they work, so the number of hours they work is totally up to the employer. What you want to make sure you're doing, though, is as you're assigning hours, that you're doing it in a non-discriminatory fashion, so that you don't have some employees starting towards then their cohorts, and they start to think it's because of either their race, their sex, their nationality, things of those protected classifications.
Okay, so if an employer says, look, we're going to keep you working 40 hours a week, but we need to reduce your pay from $15 an hour to $12 an hour for the duration, that's a 20% hourly pay cut. As long as that's done in a non-discriminatory manner, that's okay.
Yes, I would do it in writing, and it is prospective only. That new pay rate only applies from the time that you've given the written warning to the employee. You can't go back and say it's going to apply 2 weeks ago, because it's only prospective.
If an employer decides that they want to approach it from a different angle and say, instead of reducing your pay by 20%, we're going to just have you work 4 days instead of 5. And again, we're talking hourly non-exempt employees. Is that okay?
That is fine. Again, as long as you don't do it in a discriminatory fashion, no problem.
All right. And then if you get down, the employer says, I can only have you working 3 days a week, so you're going to work 24 hours a week. But what's the potential implication with respect to group health?
I think there you need to know what your qualifications are to continue on the group health plan. There I would check with whoever the carrier is or your insurance agent to find out how long we can keep someone at 24 hours on a temporary basis before they lose their eligibility for benefits. And then if they do lose eligibility, to make sure we follow the COBRA rules because they would be entitled to continuation under the COBRA benefits.
Okay, let me transition from hourly non-exempt to salaried exempt. One of the questions we've had from a number of our clients is, can I tell my salaried exempt people that we're only going to have them work 4 days a week instead of 5? And if so, what, if any, problems might arise from that scenario?
If the only change for the exempt employees are working 4 days instead of 5 and we're not changing their salary, there's no problem at all. The only issue comes in when we start making any change in salary. That's when you run into problems.
And if the employer's intent is, I'm going to pay them, for the 4 days, pro rata 80% of their salary, then what's the answer to that?
The answer is you cannot do that because, one, they're available and ready to work. If they work at all during the week, they get their full weekly salary. There are provisions in the FLSA for a temporary reduction in their salary due to emergency situations, and a declared national emergency would be one of those, which is what we have. But you can't reduce the salary in any event below the new $684 a week to qualify for the white-collar exemptions. So if they're normally making $750 a week and you want to lower them to $690 during the time of the crisis, you can, but you can only do that once, and then they would be reinstated back to their regular salary thereafter.
Okay. And if the client then says, okay, I get it, but I can accomplish the same thing, they'll work 5 days a week, but I'm only going to pay them 80% of the salary. That's what you indicate. You can go it from that approach as long as you're meeting the salary basis test. Is that right?
Yes, as long as you do $84 a week, then you can do that. I would make sure in my notice to the employee that I explain clearly that it is done pursuant to the national emergency, which is creating an economic crisis for the company. And in order to keep them employed and to keep the company afloat, this is the decision that needs to be made, and that is hopefully only temporary.
Okay. If you have an exempt employee who works from home 5 hours a day while self-quarantining for possible exposure to COVID-19, how does the paid sick leave apply in conjunction with the FLSA?
Well, they're working from home that day, so they clearly get the 5 hours for the time that they work. The other 3 hours, they're going to get at their regular rate of pay. And what I would simply do is dot those 3 hours out of their emergency paid leave bank of 80 hours, because that's a qualifying reason under the new statute, and they would get their regular pay. My concern would be if you've got a highly compensated employee that's above that 136,000 and change rate, where they would exceed the $500 and $511 per day cap, is that the new statute doesn't say how this interacts with the FMLA, with the FLSA. So I would still give them their full wages, but dock their emergency paid leave bank by the 3 hours.
Right. I was going to say for the hourly non-exempt, that's a relatively straightforward calculation.
Yes.
However, for the salaried exempt, it's not so simple.
Correct, because the FLSA does not allow for partial day deductions from an exempt salary's pay, except in situations covered by the FMLA. And the person being out in quarantine as a precaution is not an FMLA qualifying reason. If they're home sick because they have COVID-19, that's a serious health condition, and they would qualify for FMLA for their own serious health condition for those employers who have 50 or more employees. That's been in place since 1993 and is not affected by the new law.
Okay. Is there anything else from a big picture perspective on the FLSA that we haven't talked about that you want to talk about?
Be very careful when you start changing or looking to take deductions from exempt employees. You want to analyze this very carefully and likely get legal counsel before you do so.
Okay. All right. I am going to transition to workers' compensation, and some of you out there might think I'm a little bad and asking why is he going to talk about work comp, but actually work comp is a highly relevant topic in the context of this scenario because this disease is so highly communicable, and especially where people work in relatively close quarters. You very well may end up getting comp claims for people who claim that their COVID-19 is directly related to their work, and they want it processed as they want their comp benefits. So I'm not going to get into the weeds on this because that could be like a 30-minute discussion, but I do want to just run through a couple of basic points for consideration in terms of whether or not work comp has a role in this whole COVID-19 analysis. And for those of you who might encounter this scenario, your starting point is a three-step analysis. And the first step is to ask the question and investigate whether there's proof of an actual exposure in the workplace. Someone who just has a positive diagnosis does not mean that they got it at or because of work. So there need to be some factual proof that the person was actually exposed to the virus at work or because of work. In other words, are there coworkers or customers that have a positive diagnosis? And if so, where was that contact with those individuals and when? And the timing is no idea of how long, the incubation period is, et cetera. So that's step one. Step two is if there is any actual exposure at or because of work, compensability of a COVID-19 claim would have to pass the same standard as all work comp injuries, which is, did it arise primarily, and I emphasize the word primarily, out of the course and scope of employment? Primarily means more than 50%, considering all other possible causes. And some of you are sitting there shaking your heads like, how are we supposed to figure that out? And the answer is, well, you do the best. And if you have an insurance carrier, that's their job. If you have a TPA, that's their job. And you can help them in the analysis, and you'll do the best you can. And then the third step is to help determine if a COVID-19 exposure arose primarily out of work. The Tennessee Comp Law provides that exposure cases are only compensable if the employment exposed the employee to a greater risk of injury exposure than a member of the general public. So each employer would need to determine whether the job exposed that particular employer to risk of contracting COVID-19 than a member of the general public. So those are the three primary steps of your analysis for purposes of a work comp claim. And Ed, that work comp topic reminded me, will you please talk about who is a medical care provider, where that definition is contained, and what implications, if any, there are for people who are medical care providers as to the applicability of the FFCRA and expanded FMLA leave?
Sure. Healthcare provider is defined consistently. It's in 29 CFR 825.102, the definitions. So it's going to include a medical doctor, osteopathy doctor that authorized to do medicine or surgery in the state, podiatrists, dentists, clinical psychologists, optometrists, chiropractors, who are also authorized to do practice in the state, as well as nurse practitioners, nurse midwives, medical social workers, and physician assistants who are authorized here in the state to practice medicine. All this would be your healthcare providers. Folks outside of this classification typically are not.
And if somebody is a healthcare provider, does the FFCRA, or how does the FFCRA apply to them, if at all?
The employer of that healthcare provider can opt out of the FFCRA with respect to those employees only. So if it's a medical group, while the doctors, they may exempt the doctors who would not then qualify for the emergency paid leave, the front office staff, the receptionist, things like that would qualify and be able to receive the benefits.
What do you think in terms of a mental health provider? Would they fall within the scope of a medical provider as defined?
Well, they've got psychologists, and I would assume psychiatrists would as well. So yes.
Okay. And then if there are people downstream from that who are therapists, et cetera, that's going to be more of a question.
That would be more of a question, yes. But I mean, clinical social workers are included, so it's really going to depend on where they are in the group, and also whether they are licensed within the state to provide the medical care.
Okay, good, good. Do me a favor. We've got about 10 minutes left. Give me a couple minutes on the big picture OSHA issues.
The big picture on OSHA is to make sure that folks are in a safe work environment, which means particularly during all of this is, one, you want to make sure you've got your cleaning procedures down, and commonly used surfaces are cleaned with appropriate cleaners, and OSHA provides a list of what those would be that would be capable of killing the coronavirus. You've got the concerns that if I've got an employee who comes into work, may seem fine today, but calls you tomorrow and says, look, I'm not feeling well, I've got the fever, I've got the cough, and then the day after says I tested positive for COVID-19, what steps do you need to take in order to notify other employees while keeping obviously confidentiality over the actual employee may have been exposed, and monitoring what folks are doing. So really the OSHA and the CDC guidelines go hand in hand, and there's a laundry list of those available on both of their websites that are worth taking a look at. There's no current requirement right now that all of a sudden you pass out face masks or ventilators or things like that for regular workplaces. Now that's going to be different obviously in healthcare environments, particularly when dealing with patients who may be suffering from COVID-19.
Ed, if an employer has a scenario where an employee says to a supervisor, hey, I just learned that so-and-so who works on third shift, who works in the same department, same machinery that I work on first shift, has been diagnosed with COVID-19. What are the general, between CDC and OSHA, what are the general guidelines or recommendations for how you address that scenario?
First is you will hopefully have been doing the cleaning in between shifts and on a frequent basis, so that when that employee on third shift left, that the machine area was cleaned properly before the first shift employee got there to limit the risk of exposure. The other then is to tell the employees that kind of given that, here's what we've done to clean the space. Do it. Certainly take the extra precaution of cleaning it again before allowing the employee to use it, and then certainly monitor that employee and those in the immediate area to make sure that they remain healthy.
And if I understand it correctly, I believe I heard that it's either OSHA or the CDC has recommended that before the cleaning, once you become aware of the fact that the area may have been contaminated, before you start cleaning it, that there be a 24-hour stand down where the area just be left alone and people not be in it. Does that sound right?
That does sound right.
Okay. And then if you are going to hire a third party who claims that they know how to actually remediate this type of an issue and that they know the chemicals you can use and that you can't use, et cetera, I'm assuming that you would recommend to the listeners that they would want to try to do some sort of due diligence to make sure that the people who are claiming that they know how to actually clean it the right way actually know how to clean it the right way, instead of it just being some guy off the street who's trying to make a fast buck.
There's the old trust but verify, and I think that would be applicable here.
Okay. Is there anything else on sort of the OSHA overview that you would like to share with us?
No, and I think, again, keeping track of any updates from the CDC, which, again, they do a very good job on their website of keeping things up to date and new guidance coming out on a fairly regular basis that needs to be updated, continue to look at that on a frequent basis.
Okay. Then let me transition to the ADA. I won't spend too much time on the ADA, but there are some issues there that I think are worth just making this. It's a pretty good read. It's not too long, and it gives you some good information. But then just last week on March 18th, they issued an email alert that has Q&A that is in alignment with the pandemic preparedness guidance that was issued in 2009 that is specific to the COVID-19 scenario. So if you haven't accessed that information, OC.gov, I have. Purposes of ADA analysis, the sort of the overarching question that we get is, well, if somebody gets COVID-19, is that a disability? And the answer is, I don't know. Depends on how they react to it. If somebody gets well very quickly, probably not. If somebody ends up with some permanent residual limitations from COVID-19 that affect their ability to perform their functions, the essential functions of their job, well, they very well may have a covered disability. But from a practical, my guidance to you is let's not worry about whether or not somebody who gets COVID-19 has a disability. Let's focus on what our procedure is going to be with each and every person who tells us that they've either been exposed to or that they've been diagnosed with or that they actually have symptoms of, even if they haven't been diagnosed with COVID-19. So we want to make sure that we have a standard sort of Q&A, or at least a standard set of issues that we will address with every single person, so that we are, for those of you in manufacturing, you understand the concept of consistency of process. We want the process to be identical for each person. And then on the flip side, you're going to have the issue of, do we have consistency of outcome or consistency of application? And the answer is, it depends upon each individual scenario and how somebody ultimately recovers. But we're going to go through the same process with each person, and we'll make rational decisions based upon what we learn in the course of a person's recovery and any medical guidance that might be provided to us during that scenario. Also, from a practical application perspective, it is absolutely okay for you to ask an employee if they are experiencing common symptoms of COVID-19, and those symptoms are certainly changing, but the standard ones are fevers, chills, coughs, shortness of breath, and sore throat. Likewise, it's okay to measure body temperature, and a lot of employers are doing this. I think it's a good idea, but a couple of pitfalls. One, you need to make sure you have functional equipment that actually works. Two, you need to make sure the people that are using that equipment actually know how to use it so that they're giving you good, accurate readings and not messing the process up. And both of those issues go to the sort of direct, what's called in the ADA analysis, direct threat. Is the employee a direct threat of harm to himself or others that can't be appropriately remediated via some sort of workaround that we will provide in the form of an accommodation? So under this scenario, it's okay to do those things. It's also okay to tell an employee with symptoms to stay home, safe than sorry. And here you have, under OSHA, the general duty clause, the employer has an obligation to provide the employees with a safe work environment. If somebody is experiencing symptoms that are in alignment with what COVID-19 may be and they haven't been formally diagnosed, well, common sense dictates we're going to tell them to stay home and make sure that they are better before they come back to work. And if this is after April 1, the benefits provisions will kick in. And as Ed mentioned, if you have a diagnosis from a doctor, that's great. If you don't, the CDC has given us guidance on certain metrics we can analyze as to, how long somebody should stay home and when we might consider them able to return to work. Ed also mentioned the fitness, first on the front end, getting some sort of written diagnosis or confirmation from a medical provider that somebody has COVID-19. That's going to be very hard to do. And on the back end, getting a fitness for duty certification such that somebody's able to return to work is likewise going to be a hard thing to do under the current circumstances. So you need to look at the guidance from the CDC and apply that. And the last thing I would say on the ADA is very simply that you want to make sure you're documenting from start to finish with all employees who are expressing a need to take time off, or because they are sick, think they might be sick, or, are caring for their kids. One final, well, actually two final topics. First is on the unemployment side. If you're laying people off, you want to facilitate the unemployment process. If you go on to the Tennessee Department of Labor unemployment site, you will notice that if you are laying off a group of people, they have I believe it's an Excel spreadsheet that you, the employer, can fill out, and that will help, sort of expedite the process. On the flip side, if you're laying off a smaller number of people and you want to give people separation notices for each person, you can do that, and then the employee can go and make his or her application for unemployment benefits. I will also mention that on that same site, there is a June 2019 booklet that has lots of information about how to navigate unemployment if you want to get into the minutia about it. But I would commend it to you for further reading if you think that would be helpful, but it's out there. Now, Ed, will you give me like 2 minutes on WARN, and then I'll wrap it up.
Sure. Under the WARN Act, if you're going to have really a mass layoff, you have to be aware you may be required to provide WARN notices. It's only going to apply to employers of 100 or more, and there are limits on what employees count in that, like people who have worked less than 6 months in the past 12 months don't count, those who work less than 20 hours a week. So to remember, if you're going to have to do a major layoff, you're going to close a plant, you're going to lay off a significant number of folks, which would be 50 or more employees that constitute a third of your workforce in a particular area, then WARN may apply. You're usually required to give 60 days advance notice, but there are exceptions if there are in the events of unforeseen circumstances, and I think that would qualify here, at least during this interim time period. If we're 3 months down the road and things haven't changed, it may not be as foreseeable, be considered as unforeseeable, and the 60-day notice may apply. Just know that it's out there if you're going through significant layoffs, that is another factor you need to consider as you go through that process.
All right, Ed, thank you. All right, guys, so my wrap-up comments are this. As you can tell, there are a lot of different topics that you need to be thinking about, legally speaking, practical application speaking. And so our goal today is not to get you totally up to speed on all of these legal issues, because that would take far longer than an hour. But we're hoping to help at least give you sort of a mental checklist as to the issues you need to be thinking about, as well as some of the most commonly asked questions that we've been receiving, especially as it pertains to the application of the FFCRA and expanded FMLA as they become effective on April 1st. So with that, I'm going to close it down. So Kerry, if you have any wrap-up comments, I turn it over to you.
Well, certainly
Hey,
I want to thank you guys.
Sorry, Kerry, go ahead.
Certainly I want to thank you guys for lending us your expertise and your time. Very well done. We appreciate it. Questions, just to send those to the email address that we publish there. And that's all I had. Lauren, do you want to follow up?
Nope, that's perfect. Thank you so much, Kerry, and thank you so much, Fred and Ed, for partnering with us at the Tennessee Chamber to do this. I think this is very valuable, so thank you.
Happy to do it.
Very welcome.
Thank you.
Thanks
Have a good
all.
day.
Stay safe.
Stay healthy, everybody.
Bye.
Yep, bye.